Welcome to the Surgeon's Cut podcast. Today, we're exploring a crucial topic: what happens to your diet after gallbladder surgery? Doctor, Emily, before we get into dietary details, could you explain the gallbladder's role in our body?
Absolutely. The gallbladder is a small pouch located beneath the liver. Its main function is to store bile, a digestive fluid produced by the liver, which is released into the intestine to help break down fats. When the gallbladder is removed, bile flows directly from the liver to the intestine, but less efficiently, making fat digestion initially slower and more sensitive.
That's a clear explanation. So, without a gallbladder, our digestive system has to adjust to processing fats differently. How soon after surgery does this impact start to show? And what symptoms might patients notice?
Right after surgery, patients might notice bloating, mild diarrhea, or discomfort, especially after fatty meals. This is because the body is adapting to a constant rather than regulated bile flow. Over time, most people's digestive systems compensate, but initial dietary changes are vital to ensure a smooth recovery.
Let's transition into the critical post-surgery period. Dr. Emily, what does a typical diet look like in the first few days after gallbladder removal?
In the initial 1-2 days, a soft and liquid diet is recommended. Think clear soups, coconut water, strained lentil water, khichdi, plain yogurt, and soft fruits like banana. These foods are gentle on the digestive tract and prevent overloading the intestine while it's still recovering from surgery.
Why is it important to avoid solid or fatty foods at this stage? Could you give an analogy to help listeners understand the digestive process post-surgery?
Certainly. Imagine your intestine as a conveyor belt. After losing the gallbladder, the automatic release of bile is gone, so fats move along the belt with less lubrication. Introducing rich or heavy foods too early is like placing large, greasy boxes on a slow-moving belt. It can cause jams, leading to indigestion and discomfort.
As patients progress, what foods should they focus on to support healing and digestion in the weeks after surgery?
Great question. Fiber-rich foods like oats, brown rice, whole wheat, vegetables, and fruits facilitate smooth digestion and help prevent constipation, a common issue post-surgery. Lean proteins such as lentils, paneer, tofu, egg whites, and chicken breast are excellent for tissue repair and recovery.
Those are helpful tips. How about fluids and meal timing? Are there any best practices patients should follow?
Hydration is key. Water, buttermilk, clear soups, and lemon water keep the digestive system running smoothly. Small, frequent meals, about 4 to 5 per day, reduce strain on the intestine compared to 2 or 3 large ones. Also, including healthy fats like olive oil and walnuts in moderation ensures necessary nutrients without overwhelming the system.
Can you share a quick comparison with typical eating patterns before surgery?
Certainly. Before surgery, larger and richer meals might have been better tolerated. After gallbladder removal, the focus shifts to moderation, gradual reintroduction of foods, and careful observation of what the body can handle.
Now, let's address the flip side. What foods should patients strictly avoid, especially in the first couple of months after surgery?
It's important to steer clear of oily and fried foods like pakoras, samosas, and heavy curries. High-fat dairy such as cream and excess cheese should be limited, as should spicy, heavily seasoned dishes that can trigger acidity or diarrhea. Processed foods and carbonated drinks should also be avoided, as they tax the liver and disrupt digestion.
That's comprehensive. Are there any specific statistics or studies on the impact of these foods post-surgery?
Yes, a 2020 review in the Journal of Gastrointestinal Surgery found that up to 40% of patients who consumed high-fat diets soon after gallbladder removal experienced persistent indigestion or diarrhea. This underscores the need for dietary vigilance during recovery.
As patients look toward the future, how should their eating habits and lifestyle evolve over the long term?
Gradually, most people can return to a normal diet within 2-3 months, but moderation remains crucial. Maintaining a balanced diet and active lifestyle minimizes digestive issues. Keeping a food diary can help track which foods work well, enabling a tailored approach for each individual's digestive comfort.